For sure. So my first question is, when should someone consider having deep brain stimulation?
That is probably one of the number one questions we get in our clinic and just, well, throughout anybody, whether it's PT, neurology. And the answer depends. I know it's a terrible answer to the question, but the reality is that that's true. The prior kind of standard was it used to be the last resort treatment was, okay, you've utilized every medication cocktail imaginable. Now let's throw in for deep brain stimulation. That paradigm is almost flipped on end, and there's been a much larger push for early intervention of DBS. And the thought process there is you actually will hopefully prolong your ability to utilize medications in a better capacity because you're going to have less off times throughout, so you don't need as much medication if you're utilizing DBS earlier in diagnosis. And as far as how early, I mean, I've had people 3 months diagnosed that have had deep brain stimulation, people that have had DBS or Parkinson's for 30 years, and it really both do well. Not everybody does great, which we'll lead to later. But as far as when you should get it, it's really that conversation you have with your neurologist, your therapist.